Hello, students. Welcome to Ganviar School of Education, Suresh Ganviar University. I'm Dr. Sonia Korbansal, and today I will be teaching you about the topic Behavioral Problems in Adolescents in the subject Psychology of Teaching and Learning. So, students, my learning objective of today's lecture is about to make you understand about what are the behavioral problems of adolescents. At the end of the class, you will be really able to differentiate between the different problems of adolescents, and you will be able to understand how to manage those problems in classroom teaching. So let's start learning. I really hope that you will listen attentively and understand the concept of behavioral problems and adolescents. Now, let's understand that students, that problems refers to various problems of students like behavioral problems, emotional problems, educational problems, and social problems. So, problems related to any or the external activities of a person which are observed directly, like behavior that harms or threatens to harm others, like lying, violation of rules, etc. Are these are all considered in the category of behavioral problems. And there are some emotional problems which are the problems related to any of the particular feelings that characterize the state of mind. Educational problems include problems related to cognitive skills, teachers and parental motivation in academic field, adjustment with the school, teachers, family environment, etc. So, social problems are also there, and these are the problems related to social environment, such as social behavior, social participants, social activities, peer influence, adjustment with family, society, and religion. So, overall, what we are talking about here, we are talking about problems, but we have to consider this fact that nobody is perfect and all children will have bouts of bad behavior as well. So when the things start to get out of hand, however, it may be a clue that something in the child or teen's life need attention that's not appropriate in his behavior. So adolescent can seem irritable or even hostile. This is a stage which is really crucial from the point of view of development of all the physical aspect, mental aspect, social aspect, emotional aspect, because they are growing up and they are also trying to show that they are, yes, of course, they are growing up. So it is important to understand that children can start acting out when there are other stresses in their lives. So, reassuring the child and providing extra care may help to get them through this stressful times. And sometimes they need professional help also. So, adolescent, we all know that it is a time for developing independence. And this is a time where adolescent girl or a boy, they specifically think that they are now grown up and they can do whatever they want to do. Somehow they are away from their parents at this stage, and they are more close to the peer group, their friends. So typically adolescents exercise their independence by questioning or challenging or sometimes breaking rules also. Breaking rules for them is such a easy task that they can hardly think over it. So parents and doctors and teachers must be very aware on this stage, because they must distinguish occasional errors of judgment from a pattern of misbehavior that requires professional intervention. Sometimes mistakes are happening due to unknowing conditions or an unwanted situation. But is it being occurred every time? So that's a matter of concern. So the severity and frequency of infractions are guides. For example, regular thinking, frequent episodes of fighting at home or absenteeism without permission, truancy, and theft are much more significant than isolated episodes of some activities. Children show some drastic behavioral changes in this period because now this is a stage they are actually approaching towards adulthood and they are out of childhood. So this is very crucial stage from their point of view, that they think that they are grown up and they do such mistakes due to lack of experience, lack of exposure, lack of education. So of particular concern are adolescents who cause serious injury to themselves by using some harmful medicines or weapons in a fight. So at this time we have to understand, if we are becoming teachers, so we have to understand what are the exact problems of adolescence and how can we rectify them. So now let's understand some problems in adolescent in a very elaborated manner. So first of all, face pressures to use alcohols, cigarettes, or other drugs. Specifically, when I'm talking about Indian families, families are really very traditional and the child is here being brought up into a very traditional environment and a very protective environment, but on the same way the child goes out in the school also, and where the other children are involved themselves in into some kind of unwanted activities, consuming alcohols or cigarettes or other drugs, then such peer group pressure is considered very important, as they feel pressures to consume the same, and they make it a prestige point that if they say no their group will be left. And due to this insecurity, adolescent child commits the mistake. The next problem which we see in adolescent, that is initiate sexual relationship at very earlier stages due to hormonal issues. The sexual relationship is actually initiated at a very earlier stage, then putting themselves at a high risk for intentional or unintentional injuries. Maybe they are fighting with each other or they are actually saving each other, protecting each other. Peer group is such a pressure at this time of adolescent that the students who are going to school, they face really unwanted drastic consequences of some small fights also. Then unintended pregnancies are also one of the biggest issues. Then psycho social problems are here, nature and co-variation. We are going to discuss that substance abuse, the maladaptive use of drugs, legal and or maybe it is illegal. Internalizing disorders, problems are turned inward, emotional and cognitive distress as well. Then externalizing disorders, problems are turned outward. It becomes into behavioral problems. So substance abuse problems tend to be externalizing problems as well. Then problem behavior syndrome is shown very easily in adolescent, and many adolescents with psychosocial problems have more than one type of problem at one time. So the morbidity of externalizing and substance abuse problems has led researchers to propose theoretical explanations for the phenomena as how the problems have occurred. And this is sometimes called problem behavior syndrome. So externalizing problems in childhood, academic problems in adolescent is find out, and internalizing problems in adulthood as well. Now, problems behavior syndrome theoretical explanation. So, unconventionality in adolescent personality and social environment leads to high risk taking behaviors. So, tolerance of divines, not connected to school, religious institutions, highly liberal views. Involvement in one problem behavior may lead to involvement in second one as well. So these are some behavioral syndromes that needs to be given theoretical explanations. Now let's have a look on prevalence of substance use and abuse. Most adolescents have experimented with cigarettes, tobaccos, and local alcohol, but not with other drugs. Only a very small number of adolescents, it is said that researchers do say that use any substance daily. One six smokes cigarettes every day. This is based on data. You can have a look on the diagram, and this is the data given to you. Now, earlier age of initiation. So, adolescents are experimenting with drugs at earlier ages than in the past. So, the chances of becoming addicted to alcohol or nicotine are increased when use begins before at the age of 14. And this is really a serious issue. Drugs can affect dopamine production in the brain, possibly altering it permanently. And this is leading to the serious consequences. The effects of alcohol or nicotine on brain functioning, especially memory, are worse in adolescent than in adulthood. Then risk factors for substance abuse is there. That major risk factors are here. Personality related factors are here, like anger, impulsivity, and inattentiveness in doing smallest activities. Then family related risk factors are distant, hostile, or conflicted relationship with parents, siblings, or grandparents. Adolescent is always away from the family and doesn't want to be involved in any kind of functions, any kind of activities, whatever is happening in the family. So a distance is maintained at this stage. Then socially, risk factors may be involving friends who use and tolerate the use of drugs, living in a context that makes drugs use very easy, and it is actually great substance abuse and leading to risk factors. Then externalizing problems like conduct disorder, which we have earlier studied CD. So conduct disorder is a pattern of persistent antisocial behavior that routinely violates the rights of others and leads to problems in social relationships, school, or work. So this is conduct disorder. This is actually giving pleasure to yourself when you are hurting someone. So related diagnosis is oppositional, defined or disorder, less aggressive also. So if CD persists beyond the age of 18, may be diagnosed with antisocial personality disorder. So characterized by a lack of regard for moral standards, psychopaths, etc. So, adolescent offenders. Let's have a look on this theme. That how do adolescent become offenders? So, first of all, life course persistent offenders, and these adolescents demonstrate antisocial behavior before adolescence, and these are involved in delinquency during adolescence and are found at a great risk for continuing criminal activity in adulthood. And adolescent limited offenders engage in antisocial behavior only during adolescent period. Then life course persistent offenders are also there, and usually they are poor male, perform poorly in school, from disorganized family with hostile or inept patterns. And moreover, the harsh parenting may affect brain chemistry. Serotonin hormone is actually disturbed here. So have histories of aggression identifiable as early as age 8, have problems with self-regulation, more likely than peers to suffer from ADHD. So attention deficiency, hypertension disorder, which we have already discussed earlier. Then adolescent limited offending. They do not usually show signs of psychological problems at family pathology. More mental health, substance abuse, and financial problems are there, including risk factor like poor parenting, affiliation with antisocial peers. So poor monitoring is here, and adolescents are actually limited offending. Now let's have a look on the protective factors, which major protective factors are positive mental health, high academic achievement. These are going to help the adolescent for curing themselves from all kind of problems which are occurring at this stage proper, specifically. Engagement in schools, close family relationship, involvement in religious activities. The most encouraging interventions are programs that combined social competence training, community wide interventions aimed at adolescent, peers, parents, and teachers. Then, depression in adolescents. Depression is the most common internalizing problems among adolescents. This is the situation where the children feel alone with themselves. This may be due to some unwanted situation, or they are not feeling happy on a particular situation. So emotional symptoms may lead to decreased in enjoyment of pleasure activities. Motivational symptoms are also there. Apathy, boredom is there. Physical symptoms like loss of appetite, difficulty in sleeping patterns, loss of energy is there. So this is the severe symptom of depression in adolescent. Then six differences in depression is also there. Depression is something which is not a really good state. Before adolescent, boys are more likely to exhibit depressive symptoms. But after puberty, girls are more likely to be depressed, possibly because of gender roles, pressure to act passive, dependent, and fragile. This is common in Indian society. So, greater levels of stress during early adolescent is also there. Greater sensitivity to others, oxytocin level is also there. So, sex difference is the great role in causing the depression among adolescents. Then adolescent suicide. This is the another problem which is actually very serious. So 20% of high school students think about killing themselves every year. Suicidal ideation is there. So when something is not according to their own will, if the results are not according to their own will, if the happenings are not around according to their way, so they think of killing themselves. So risk factor include having a psychiatric problem as well. So having a family history of suicide, experiencing extreme family conflict, being under intense stress like fail in the exam, so and maybe the pressure of peer group, or maybe the parents or the society, that expectations lead to them with high level of stress, and that is definitely forcing them to think about killing themselves. And this is really a very serious issue, serious behavioral problem. Then let's have a look on stress and coping as well. So stress responses vary. Stress is not same in all the adolescents. It varies from person to person. So multiple stressors have a much greater impact than single stressors. Multiplicative. So using more effective coping strategies buffers the effect of stress. And primary control, taking steps to change the source of stress, usually the best strategy. So secondary control strategies are also there, and this really actually adopt to the problem better than situation is uncontrollable. So overall, students, you have to understand that adolescent is a stage where all adolescent boys and girls, they find different problems, but stress and their coping is really very important. So how do they cope with each other, and how do they actually feel when they are about to do something very important? So that's really very important for all of you to understand. All right, students, so let's understand further that how it is actually moving. Now, authoritative parenting is also one of the greatest problem in this stage. So, authoritative parenting is a parenting style in which children participate in establishing family expectations and rules only. This parenting style where the parents have full control on children as opposed to authoritarian style parenting in which parents make decisions with minimal input from their children. The deciding authorities are only parents, what the child will do, what the child will wear, what the child will eat, how the child will do his studies. All the things are actually decided by the parents. So this permissive parenting in which parents set few limits is most likely to promote mature behaviors. But some limit is okay, some authoritative parenting, but if it is out of control or it is suppressive to the child, then it becomes a problem. So authoritative parenting uses a system of graduated privileges in which adolescents initially are given small bits of responsibility like caring for a pet, doing household chores, purchasing clothing, decorating their room, cleaning their room, or managing their allowances, just keeping their cupboards in a very proper way, keeping their shirts in a proper way. So if adolescents handle the responsibility or privilege well over a period of time, then there are the chances that they will be bearing more and more responsibilities later on stages. So more privilege such as going out with friends without parents and driving are granted. So if the child is doing this, the parents are granting such things, but by contrast poor management, poor judgment, or lack of responsibility leads to loss of privileges. So each new privilege requires close monitoring by parents to make sure adolescents comply with the agreed upon rules. So this is the way that how the behavioral problems can be rectified among the adolescents. Now some parents and their adolescent clash over almost everything. There are many parents, many children, and to be elaborative on this way, the school counselor teacher is having such a huge record of such adolescent boys and girls who are not happy with their parents. So situations are really in bit confusing manner or in a very critical manner. So in these situations, the core issue is really control. How to control the kids. Parents are actually right on their part and as they want to control their kids, but in the right way. So adolescents want to feel in order of their life, and parents want adolescent to know the parents still make the rules. So, in these situations, everyone may benefit from the parents picking the battles and focusing their efforts on the adolescents' actions. If the home environment is not good and the parents are over pressurizing the child for doing something, so that kind of behavior is not appreciable, such as attending school and complying with household responsibilities rather than on expressions such as dresses, hairstyles, and preferred entertainment. So this is about the authoritative parenting, and now let's understand about some specific behavior disorders. Now, students, there are many behavioral disorders which are leading to behavioral problems. Disruptive behavioral disorders are common during adolescence. So attention deficit hyperactivity disorder, ADHD, which I have already told you in my another lecture also, it is the most common mental health disorder of childhood and often persist into adolescence and adulthood. So, however, adolescents who have difficulty paying attention may instead have another disorder such as depression or maybe learning disability in all subjects or maybe in one subject. So, although ADHD is often treated with stimulant drugs such as amphetamine or methylphenidate, which can potentially be misused, such treatment does not appear to increase the risk of developing or substance use disorder, and may even decrease the risk. So, on the other hand, some adolescents complain of symptoms of inattention in an attempt to obtain prescriptions for stimulants, either to be used as a study or add to recreationally. Now, another important behavioral problem is that leading towards violence and gang membership. This is the major problem in this stage. So, children occasionally engage in physically confrontation, and during adolescence, the frequency and severity of violent interactions may increase. It may be due to hormone, it may be due to the authoritative parenting that the child is actually carrying out, adolescent child is carrying out his frustration outside. So, although episodes of violence at school are highly publicized, adolescents are much more likely to be involved in violent episodes. So, more often the threat of violence is there at home and outside of school. So, many factors contribute to an increased risk of violence for adolescents, and this may include developmental problems. And as I have already told you, there are many developmental problems. It may be related to physical aspect, social aspect, mental aspect, emotional aspect. So, developmental problems are many. Maybe they are feeling frustrated in some sort of subject that the parents have unwillingly told them to study. So this is really a important matter of concern in adolescent stage. Then another thing is gang membership. Gang means a group of such students who are involved in unwanted activities. They are not socially acceptable. Either it is teasing to another group of people, so it will be actually not appreciated. Access to firearms, substance use, then poverty is the biggest cause which is leading to the problem. So there is a little evidence to suggest relationship between violence and genetic defects or chromosomal abnormalities. So it is more related with environmental factors as well. Now, gang membership has been linked with violent behavior. So, youth gangs are self informed associations made up of three or more members, typically ranging in age from 13 to 24. And these are the groups of 5 to 7 people, or 11 people, or 10 or more than, or maybe it is only 5 up to the number. But these are actually the people, the group of people which is closely linked with each other. And if someone is in problem, then the person who is in the problem calls another member of the gang, and they create some kind of violence to terrify the another person so that it should not be repeated. But this leads to very legal complexities as well. So gangs usually adopt a name as well in this stage, and identifying symbols as well. So such as particular style of clothing, maybe they are wearing a particular type of t-shirt, sub, or pants, the use of certain hand signs, certain tattoos, or maybe the hairstyle, or maybe the way they speak, or graffiti, or maybe they are wishing each other. So some gangs require prospective members to perform random act to violence before membership is granted. So this is how the gangs are made, and in this is actually leading the adolescent towards an unproductive activity which is leading to the violence, and it is also keeping him away from the studies, and which later on causing frustration among the adolescent as well, but as well as within the parents and teachers also. So this is a big problem in adolescent, that how to keep focus the child, how to enable him in understanding the different concepts of the optional subject which he has or she has chosen, how to make him career oriented, how to make him professionally sound by the course of time. So this gang membership is really very dangerous. So violence prevention begins in early childhood. with violence free discipline. So it is well said that whatever the child sees at home, the child is actually follows that. I give you one example. The child is very naughty and the child is not listening to his mother as well as not listening to the grandmother. So what the child is doing? The child is actually not obeying. Disobedience is there for not obeying certain tasks, not doing that. But when the mother and grandmother, they are frustrated and they are not happy with this disobedient behavior, so by that time the child is facing some punishment to create the discipline. So this is how the child is actually facing the problem, and the mother immediately keeps the child in a closed room or in a particular area of the home where the child is closed or locked. So what kind of behavior do you expect from a child later on? The child thinks that this is the appropriate behavior, or maybe the mother is giving a slap, or the elder sister is giving a slap on misbehaving. So the child thinks that if someone is not agreeing on a particular point, then this is the right way to handle the situation, to slap someone or to become violent and get the things in favor of yourself. So this is how I mean to say that violence prevention is really very important task, and this will be happening from home only and in early childhood only. And really, the well coordination of parents as well as teachers will lead to its success. So, limiting exposure to violence through media and video games may also help, because exposure of these violent images has been shown to desensitize children to violence and cause children to accept violence as part of their life. So it's really very important what the children do see on televisions, what kind of programs they are watching. Are they really watching something that is related to fights and all violent task activities? So it is rightly said, whatever we do see, we perceive it, and we try to actually conduct that in a practical form. So school age children should have a safe access to safe school environment as well as safe home environment. They must be actually given limited exposure. Whatever the violence related activities on TV and through media videos are shown to them. Video games must be really handled very seriously. So older children and adolescents should not have access to weapons and should be taught to avoid high risk situations such as places or settings where others have weapons or are using alcohols or drugs, and to use strategies to diffuse these tensions as well or situations. So in that case, violence is not actually occurring all of a sudden. Just try to understand, students. Violence is something that is being nurtured for a long time since childhood. And the child thinks this is the best solution to win over the situation, win over the people. As he or she himself has seen this at their home environment. So, this is how we can control the violence prevalence in adolescent stage. Now, let's discuss about treatment and prevention of internalizing problems. So, how we can give the treatment and prevention. So, treatment approaches can be biological therapies, psychotherapies, family therapies. So, when we are talking about biological therapies, it is leading to antidepressant medicines which the doctor gives, SSRIs, that addresses the neuroendocrine problems that may exist. So it will be done through doctors only. Psychotherapy is the designed to help adolescents through guidance and counseling in a proper way to come out of the depression and change in their cognitive, affective, and psychomotor behavior. So these treatments are really appreciable if they are actually, if the problems are recognized at the sooner stage. So the treatment is really very effective very early. Then family therapy is really very helpful, changing patterns of family relationship that contributes to symptoms. If the parents are fighting all the time, then they must stop this in front of their child. Or if there is any other kind of problem in the family, so that must also be rectified by thinking that this will be perceived, will be absorbed by our child, and it will lead to dangerous situations. Now, prevention approaches will lead to primary preventions as well as secondary prevention. So, primary prevention is about teaching adolescents life skills to help them cope with stress. Then, secondary prevention is about aiming at adolescents who are at risk of depression or are at under stress. So, this is really very important for the teacher, for the parent to have a good control or have a good approach for solving the behavioral problems of adolescent. So we can say, students, that reassuring the child, in conclusion, that reassuring the child and providing extra care will be leading to a good code of behavior. We can also seek professional help, particularly if the problem lasts many months and it is not being rectified. So the first and foremost duty of parents, relatives, and neighbor is to take special care. So here we can say that there are many problems which are found in adolescence stage, because adolescence is a time for developing independence, as I have already told you, and typically adolescents exercise their independence by questioning or challenging and sometimes breaking rules. Parents and doctors must distinguish occasional errors of judgment or frequent errors of judgment, so that must be clarified. All right, students, we have discussed about authoritative parenting, and it is a parenting style which children participate in establishing family expectations and rules. So, this parenting style, as opposed to authoritarian style parenting, in which parents make decisions with minimal input from children, or permissive parenting, in which parents set few limits as well. So, adolescent behavior is something which is guided by parenting as well. Authoritative parenting, when we discussed about it, uses a system of graduate privileges in which adolescents initially are given small bits of responsibilities. And if adolescents handle these responsibilities at a time very nicely or privileged, well over a period of time, more responsibilities are given to him. Maybe it is going out with friends, or just enjoying or hanging around with friends, so these are granted by the parents. So we have really discussed about it, like violence and gang membership as well. What is the gang membership? Violence prevention we have studied. So this is how behavioral problems in children, in specifically when we talk about adolescent. So this is something, the types of problems may differ by the age of the child, but the problems may be conducted. Maybe it is physical problem, emotional problem, mental problem, behavioral problem. So emotional and behavioral problems are also there. So during childhood and adolescence are a common concern of parents and mental health stakeholders as well. So however, little has been documented about this, that children are having emotional and behavioral problems, prevalence in Indian children. But it has to be thought that how the children are having problems. So researchers agree that child and adolescent emotional behavior problems predict numerous problematic outcomes in adulthood. So numerous other problems which will occur in later stage, that is adulthood. So it has to be rectified in proper stage. So serious challenges may appear in the many important life domains, including family functioning, mental health, education, employment. If these type of problems are persisting for so long, for example, student, it is well established that oppositional defined system in childhood may result not only in conduct disorder but also predict substance use, risky sexual behaviors as well, serious criminal acts which will be leading by the adolescents, and it will be continued in adulthood also. So some disruptive children may commit delinquent acts also if it is not being controlled timely, which makes them 2 or 3 times more likely to become violent, which we have discussed just now, that how becoming violent becomes very easy, but gets very hard to get rid of it. And it is leading to the serious and chronic offenders and have longer delinquency careers. So, similarly, studies also suggest that emotional problems increase with age and place affected children at risk of not only developing anxiety or disorders and depressive disorders, but also incur deficiencies in social problem solving skills, learning problems, academic achievement, and cognitive deficiencies. Therefore, children who suffer from these type of behavioral problems are at increased risk of developing future problems also that interfere with diverse aspects of their lives which affect their mental health. So it's really, in concluding part, I can say that behavioral problems must not be taken very easily, and it should be actually cured within time, because parents, teachers, family members all are responsible for bringing up the child's cognitive, affective, and psychomotor abilities. So it's really very important for the child to understand that he is secure in his family environment. And that's why I'm talking about reassuring the child again and again that yes, you are secure at home. We are providing extra care to you. So, students, it must be understood by everyone that childhood is the stage which is called the base of adolescence. So the basic learning must be very strong, ethical, disciplined, but in a very flexible environment, not very strict. But later on, if the behavioral problems are there, then parents must not be shy or teachers must not be hesitant to seek professional help. And particularly if the problems last for so long, many months. So this is really an alarming situation. So this is the duty of parents, relatives, and neighbor to take special care of the adolescent if they find any behavioral abnormalities. So students, these are some references for your more study purpose, and I really believe that you will study them and you will enhance your knowledge about adolescents problems and how the different problems are cured and treatment is given. So now MCQs. So first is, and really, yeah, I'm giving you MCQs, and all of you, I request students you to put the answers in my comment box. All right. So first question is, the discipline of child development is A, the systematic study of children's development grounded in empirical research and theory building. B, knowledge that the child has about his own developmental process. C, the study of parent child relationship. D, the study of children in their social context. So just tell me the right answer. Okay. Then second question, what was one of the earliest scientific studies of child development? A. Piaget case studies of his own children. Freud's case studies of his patients. C. Darwin's case study of his son's development. Or D. Binet's research into children's intelligence. So what is the right answer? Yes, hurry up, students. Give me the answer in my comment box. So, students, we have studied about behavioral problems in adolescent, and it's really very important topic for all of you to understand, because all of you are going to become prospective teachers, and it's really very important for you to understand the significance of understanding the behavioral problems among the children, among the adolescent. Because if you are not aware about their problems, how can you teach them? How can you achieve your behavioral objectives? All right, students. So recognize your students' problem as well as try to treat them in a very amicable way. I hope you have understood and enjoyed my lecture. So see you in the next class. Till then, stay safe, stay healthy, and keep learning. Thank you, students.